I mean, if 10 years ago, if you had said that we're going to chop off the body parts of our kids, you would be put in jail. You would be sent to a mental health facility. You know, there's 21 other states that have actually introduced the SAFE Act, which is the one that we're talking about. And I'm actually in communication with the legislator that has actually passed this legislation. And we're going to make sure that we protect all of Virginia's children, that we're not going to be mutilating children in Virginia.
That is the voice of Virginia State Senator Amanda Chase speaking about her plan to prevent children in her state from receiving medical gender transition surgeries. The legislation is a version of the Save Adolescents from Experimentation Act, first introduced in Arkansas in 2021 to ban gender-affirming medical procedures for those under the age of 18. State Senator Amanda Chase is here with us now. Welcome. Thanks so much for coming on. Why is this a priority of yours?
Well, first of all, we need to protect minor children in Virginia. This is experimental medical practice. This is sterilization of our kids. It's physical, mental, and emotional abuse at the hands of woke medical providers. And it actually increased the risk of suicide. You don't want to talk about following the science instead of the political science. If we're going to follow that, then we need to make sure that gender transition is recognized for what it is. It's an experiment. It is not medical care. And so I'm going to make sure, this Mama 4 is going to make sure that we don't experiment on our kids.
You're going at the gender reassignment surgeries, a very different way than a colleague of yours, a Democrat state delegate introducing a bill which would expand the definition of child abuse to include inflicting physical or mental injury on children due to their gender identity or sexual orientation. Again, this is how ABC7 describes it, that it would be basically child abuse. Parents could be facing a criminal charge if they didn't affirm their child's LGBTQ identity. Tell me about how these two differing viewpoints are being discussed within the Virginia state legislature.
Well, you know, if this legislator had introduced this legislation even 10 years ago, they would be committed to a mental institution. I mean, that's where we are with this extreme left woke agenda. It defies all common sense. And now we have woke medical providers, woke legislators pushing this viewpoint that it's okay to mutilate and sterilize our kids. It's ludicrous to try to normalize this. And, you know, I really want to especially make sure parents are paying attention to what their K-5 kids are reading in the public schools, because as early as K-5, public school students are reading this propaganda by the extreme left to desensitize them and normalize what I consider, what most people consider, dysfunctional behavior. And so I'm going to be the stopgap in Virginia. We're not going to allow this extreme agenda in Virginia.
The Virginia Department of Education, though, is delaying some changes to the state's transgender policies for kids in public schools. The guidance was released by Governor Glenn Youngkin's administration in September. It directed the state's 133 school districts to adopt guidelines directing transgender students to school facilities and programs that match their birth sex. Essentially, biological men would only be able to participate in boys' sports, even if they were identifying as a female. Tell me about Virginia's plan. What's the very latest with how it's actually being implemented?
Well, first of all, I applaud Governor Youngkin for introducing this revision of our model policies here in Virginia. State law actually stipulates that the effective date of any guidance document must be delayed for an additional 30-day period if a written comment received during a public comment period asserts that the guidance is against the law. So that's the only reason for the delay on that, but it will probably go into effect right after Thanksgiving.
All right, we'll be watching for it. And of course, keep an eye on your legislation, the potential next steps you might be taking to introduce it, and we'll see if it gets the support it would need to pass. Virginia State Senator Amanda Chase, thanks so much for joining us this morning.
Thank you.
You're welcome.